Navigating Ethical Waters, a comprehensive approach to nursing ethics, where we dive deep into the real-world application of the 2025 Nursing Code of Ethics. I'm Jodi O'Malley, whistleblower and founder of Righteous RN. In this course, we'll explore what it truly means to practice with courage, integrity, and moral clarity in today's healthcare landscape. Let's get started.
Welcome back, everyone. Today, we're going to talk about something that's at the heart of our profession: balancing hospital policies with ethical, evidence-based nursing care. Policies can either improve or hinder patient care. As nurses, we must evaluate whether protocols prioritize the patient or the institution. Remember back to Module 1 and the principles we are to uphold? Veracity, truth-telling, even when it's difficult. But as nurses, truth-telling is non-negotiable. It's how trust is built and how healing begins. Autonomy, respecting a person's right to make their own choices. But our code is clear. People have the right to understand, question, and say no. Justice, ensuring fair and equitable treatment for all. Many of us saw the injustice, and we weren't allowed to say a word. Beneficence, doing good, acting in the patient's best interest. Protocols often took precedence over people. Nurses were told what to do, not asked what is best. Yet beneficence demands we serve the individual, not the system. Non-maleficence, do no harm. This principle invites us to name that truth and take responsibility. Accountability, taking responsibility for our act. Number 1, nurses must actively question and report harmful policies. Number 2, nurses must ensure that healthcare policies do not create or reinforce health disparities. Number 3, nurses are responsible for recognizing and escalating ethical conflicts when policies interfere with individualized patient care. Discussion prompt. How can nurses balance professional conduct with the responsibility to share critical information? When I first heard the government had suggested sheltering in place with the 2 weeks to slow the spread campaign and the subsequent protocols and policies that followed, I was baffled at how ethical and professional healthcare workers could go along with this. And then I learned about the PrEP Act. So today we're diving into the PrEP Act and its impact on nursing practice, not just in theory, but in the real world scenarios that many of you have faced or may face in the future. Have you heard of the PrEP Act? The PrEP Act grants liability immunity to healthcare providers, manufacturers, and institutions administering countermeasures during the public health emergencies. While this protection is designed to ensure swift action in crises, it creates challenges for advocacy. The takeaway? The PrEP Act is about protection, but it also raises serious ethical concerns when bad decisions or harmful outcomes are shielded from accountability. This is why transparency and integrity in healthcare are more important. Medical countermeasures are drugs, vaccines, devices, or biologics used to diagnose, treat, or prevent conditions during emergencies, whether from biological threats like anthrax or smallpox, chemical or radiological hazards, or emerging diseases like COVID-19 or Ebola. These products are often developed or deployed under emergency conditions, which is why they fall under PrEP Act's liability shield. But just because something isn't authorized doesn't mean it's always ethical, effective, or safe. That's where your role as a nurse comes in, to balance legal compliance with evidence-based, patient-centered care. The term covered persons is intentionally left broad. It includes not just healthcare professionals like nurses and doctors, but also manufacturers, distributors, program planners like health agencies or hospitals, and even employers or organizations involved in distributing or administering countermeasures. Bottom line, in a declared emergency, nearly anyone authorized to participate in administering or distributing countermeasures can qualify as a covered person, even if they aren't normally part of the healthcare team. Let's look at what's considered a covered countermeasure under the PrEP Act. These include a wide range of interventions: vaccines like the COVID-19 or smallpox, medications such as antivirals or monoclonal antibodies, medical devices like ventilators or PPE, and even diagnostic tools like PCR tests or rapid antigen tests. If these tools are authorized, recommended, or approved by the FDA and deployed during a declared emergency, they are legally protected. This declaration outlines the time period of immunity, the covered countermeasures, the target's population or geographic area. While this fast-tracked emergency protocols, it also reduced oversight, creating risk for patient harm and nurse moral injury. As nurses, we must understand how these emergency powers impact informed consent, standard of care, and our ability to advocate safely. Let's talk about the CICP. The only option patients have if they're injured by a COVID-19 vaccine or other countermeasure covered under the PrEP Act. Unlike traditional malpractice or injury cases, patients can't sue the manufacturer or provider. Their only option is to file a claim through the CICP, which has a high bar for approval and very limited compensation. Let's talk about what all this means for us as nurses. First, if you're administering a vaccine or treatment under an emergency use authorization, EUA, or other PrEP Act guidance, you are generally immune from liability as long as you're following your facility's protocols. But here's where the ethical weight falls on us. Patients harmed by these interventions have limited options for justice. They can't sue. Their only option is to file a claim through the CICP, which is often slow, complex, and rarely results in compensation. So what can we do? Documentation becomes critical. Always ask patients, have you received any recent vaccines or treatment? When did your symptoms begin? Then, record their words factually, document the timeline, and note any concerns they express without bias or interpretation. Let's close with this reminder. Yes, the PrEP Act offers legal immunity to providers, but that doesn't mean we lose our ethical compass. Our role as nurses is to uphold truth, transparency, and patient-centered care, especially when systems or protocols feel rushed, flawed, or unclear. Knowledge is power, and ethical action starts with understanding the frameworks that govern our practice. So I'll leave you with this reflection. What steps can you take this week to strengthen your role as an advocate in challenging situations? Maybe it's reviewing your facility's documentation standards. Maybe it's bringing up a concern in your next team huddle. Or maybe it's simply reminding a patient that their voice matters. Whatever it is, take one step. Advocacy is not just a duty. It's a daily case study, the impact of the PrEP Act on patient outcomes. Scenario: hospital restricted treatment options under the PrEP Act. A nurse witnessed a patient deteriorating after receiving a mandated protocol-based treatment. The nurse advocated for an alternative treatment, but was told, just follow protocol. Thank you for being part of this discussion. Your feedback will help refine the module.
Thanks for joining me for this module of Navigating Ethical Waters. I hope it challenged and inspired you to lead with boldness and ethical conviction. If you're ready to walk this road with other nurses committed to truth and integrity, visit righteousrn.com. And remember, standing for what's right isn't easy, but it's always worth it. See you in the next module.